How may I help you?
Hi, I would like to speak to the pharmacist, please.
Okay, if you don't mind, please step over to the consultation area, and Adrian, the pharmacist, will be with you in just a minute.
Okay.
Adrian, you have a consultation on 30 minutes.
All right, great. Thank you, Maria. Hi, how are you?
Tired, how are you?
Oh, I'm okay. Sorry that you're tired right now. I'm Adrian, I'm the pharmacist. So you have a consultation for me?
Yes, I was just wondering if you could recommend like any medication
Sure,
for
I'll be-
my sleep, because I have trouble sleeping.
All right, I'll be happy to help. What's your name?
Leah.
All right, Leah, do me a favor, have a seat for me, okay? All right, Leah, I would like to ask you a few questions just so I can give you the best possible recommendation. Is this okay?
Yeah, that's fine.
All right, Leah. First, how old are you?
54?
54, and you have trouble falling asleep?
Yes.
All right, and what about problems staying asleep once you have fallen asleep?
Yes, I do have that problem.
All right, I bet you're feeling exhausted right now, so how long has this been going on?
For a couple of weeks now. I mean, it's getting worse because I would be able to fall asleep, but I will wake up a couple of times in the middle of the night, and it's like annoying, and I can't go back to sleep once I'm awake.
You must be really tired and probably ready to get home and go to bed. I'd like to ask you a few more questions just in order to give you the best possible care. So thanks for taking your time, but I'll try to make it quick for you. Is there any type of stressor in your life right now that has caused the problems that you're having in sleep?
Well, my daughter just got her license, so ever since that happened, like I can't sleep. Like, it's gotten so bad that when like I can't even go to sleep, I can't stay asleep, I can't do anything.
Wow, you must be really concerned for her. Is this the first time that you're going through something like this?
Yes.
All right. Have you talked to the healthcare provider, your doctor, or the nurse practitioner about the problems that you're having with the anxiety and the trouble sleeping yet?
I mean, I tried to make an appointment, but it seemed like very impossible to like get an appointment. I mean, I do see my doctor once a year unless like something crazy comes up.
Oh, that must be really frustrating. I know trying to get into the doctors is always a process, I know. But I'm glad you're taking the time to come out and talk to me about this, so I'm happy that I could try and help you, okay? So I'd like to ask, how is your sleep hygiene?
What do you mean by that?
Well, having good sleep hygiene is very essential to having a good night's sleep. It's kind of the first line therapy. That involves having routine, comfort, relaxing before bed, avoiding electronics in bed, and using the bed only for sleep and intimacy, among some other things as well.
Well, I do watch TV like before bed, and I like to run like an hour before bed too. So.
Okay. After we finish with the consultation, I'll discuss what we went over and make some suggestions on how we can improve sleep hygiene, so that way we can improve your sleep as well. What do you do for a living?
I'm a clerk at the courthouse.
Okay. What type of medical history do you have right now?
I have hypothyroidism.
All right. And what medications are you currently taking?
I think it's like levothyroxine, 112 milligram daily.
Okay. Do you know how long you've had hypothyroidism?
I don't remember, but I think it's been years.
Okay. Is that the only prescription medication that you're currently taking? What about over-the-counter medications?
I take multivitamin daily, and I started taking this thing like Dr. Oz was talking about, like resveratrol or something like that.
Resveratrol?
Yeah.
Yeah, I know. I actually saw the episode myself on Dr. Oz. Every time he recommends something, it sells out like the next week in the pharmacy. So he's very popular. All right. What drug allergies do you have?
I don't have any drug allergies.
Okay. Aside from not having drug allergies, what about for allergies with environmental factors or food?
No, surprisingly, I don't have them. Any of that.
I know the pollen gets me around here. I'd like to get a good idea of what's causing the sleep problem. So I have some personal questions I'd like to ask you about your social history. So you've already mentioned that you do exercise, but how is your diet?
Oof, that could be a lot better. I mean, ever since McDonald's has like this breakfast all day thing, I feel like I spend a lot of time there.
Oh, I do love their breakfast myself. So good. How much caffeine do you consume per day?
About 3 cups a day, but before all this started, I would drink like a cup in the morning.
Okay. What about tobacco products?
Oh, no.
All right. And how much alcohol do you typically drink per week?
A glass or two, like at dinner,
Okay.
like a few times a week.
All right. What about illicit drug use?
Oh no.
All right, sorry, I have to ask. Like I said, these questions can get a little personal. It's only to get a better idea of your medical history. So I think I'm done with my questions, though. I'd like to just kind of go over some possible treatments based on what you told me and suggestions on some alternative therapies as well. So like I said, sleep hygiene is essential in sleep improvement. You should try to avoid working out 2 to 4 hours before going to bed, as this elevates your heart rate and it'll make it difficult to sleep. Also, making the bedroom as comfortable as possible, and the relaxation is very important in getting a good night's sleep. Avoid watching TV in bed. As I said, electronics in bed is not a very good idea. So if you can't sleep and you want to watch TV, I would get up and leave the room and watch TV in a different room until you're tired. You can go back to bed, okay? You should avoid caffeine and alcohol before 4 to 6 hours prior to going to bed, as these have a tendency to give you trouble sleeping as well. So I also have some alternative therapy suggestions you could try before taking a medication, such as yoga or Tai Chi would be great. Acupuncture is great relaxation. Light therapy is another alternative, okay? As for medication, we do have something, it's called diphenhydramine, is the generic version of it. You can find it under the trade name is Benadryl or Somnidex nighttime sleep aids. You should start with a lower dose. These come as 25 milligram tablets, so take 1 tablet by mouth about 30 to 60 minutes prior to going to bed. It is an antihistamine, and it works by blocking the histamine receptors. So the reason I'm recommending this particular sleep aid for you is because it's the only medication that's currently FDA approved for safety and efficacy for sleep. And it's also used as a sleep aid because it has a sedating effect to it. Now, you shouldn't take it every day. Take 1 tablet, like I said, 2 to 3 minutes, two to three nights, and then skip a dose and see if your insomnia has improved. If it hasn't, try 2 tablets, 50 milligrams, and do that again 2 to 3 nights, and skip a night to see if it's improved. If it hasn't improved, you should see the physician and see if they could recommend something. You shouldn't use diphenhydramine longer than 10 days, and you should avoid alcohol while taking diphenhydramine, as it could increase the effects, okay? You should notice it start working in about 30 minutes. Side effects could include sedation, daytime grogginess, dry mouth, dry eyes, dizziness, and confusion. And also be aware of any allergic reactions, such as hives, swelling, itchiness, and most importantly, difficulty breathing. If you experience any kind of allergic reaction, or dizziness, passing out, or a change in balance, consult your doctor immediately, okay?
Okay.
All right, so I'd like to talk to your doctor about that, and then I can follow up with you, if you don't mind writing your doctor's name and phone number as well as your number, and then we could call you as soon as we find out what your doctor recommends as well. And also, so I can follow up with see if the diphenhydramine is working for you. Leah, do you have any questions for me?
No, you are very thorough, so
All right.
thank you.
All right, well, Leah, here's my business card. Give me a call if you have any questions or concerns, and it was a pleasure meeting you, okay?
Thank you.
Thank you, Leah. Here's your diphenhydramine.
Thanks.